In January 2017, Dr. Houston Davis landed at the helm of the University of Central Arkansas in Conway. The 11th president of the school hails from Tennessee and has served stints at other higher education institutions in Georgia and Oklahoma. More than 3 years into his tenure at UCA, Dr. Davis and I sat down to talk about a variety of issues: higher education funding, the school's economic impact on the state, and most urgently, how the university is handling COVID-19. Dr. Houston Davis, first of all, thank you so much for sitting down with us. Socially distant here. I appreciate you being with us.
Glad to be here. Thank you for having me.
Let us talk about, I want to go a little biography first for people that haven't met you yet face to face, and certainly the last 6 months it's been difficult to do that. Tell me a little bit about where you grew up and how you found your way into higher education.
Sure, great. I grew up in Clarksville, Tennessee. Actually, I have to say Clarksville, Tennessee because people immediately think it's Clarksville, Arkansas, but I'm a native of Middle Tennessee, and found my way into higher education just because of an amazing experience at my undergraduate institution. Strangely enough, probably by my junior year of college, I had some sense that I wanted to work in higher education. I did not know how I would do that, but that was where the interest in this as a career was started.
Well, you've got University of Memphis, Tennessee State
Right.
University, and Vanderbilt. I knew that the Tennessee connection was going to be a strong one there. So it was Memphis, was that where you did
Memphis
undergrad?
was the undergrad.
Yeah.
It was Memphis State University at that time, University of Memphis now, and just a great experience and a lot of mentors there that sort of introduced me to the concept of the role of faculty and the role of staff and support for students. So the seed was planted there, that becoming a faculty member and then engaging myself in the work of higher education by the time I was a junior in college. Who knew that I'd be a president one day? I certainly didn't think that at that time.
There may be some people you were in college with that may have even thought the same thing. So.
I agree. Thank goodness there was no social media at that time.
So tell me, what was appealing to you about the UCA job? You obviously applied for it and from where you were before, but what was it about UCA that you thought, this is the right place for me?
Yeah, prior to being here at UCA, I'd worked in Tennessee and Oklahoma and Georgia, and then very involved nationally. I knew UCA just in its national reputation. It's known as a great academic institution. They're known for their residential college work. They're known for some of the things they've done with the Honors College over the years. So just nationally, I knew of UCA. But go back to that geographical point of view. Jenny is from Vicksburg, Mississippi, and I'm from Clarksville, Tennessee. We both are educated in the Mid-South. We love this area of the country, and the idea of being able to come to Conway, which was right in between Tennessee, Oklahoma, and Georgia, close to family, close to friends. Geographically, it put us in a really good place for our lives. Yeah. So professionally, I knew that it was a great place. If I was lucky enough to become president there, I knew that it was a great university to get the opportunity to lead. But we also knew that Conway was a special place to live, and it put us right back in the middle of some great distances from family reunions and great friends.
Let's begin with a recent economic study that came out about UCA's economic impact on the state of Arkansas. A little over $1 billion of economic impact, supporting over 19,000 jobs. Tell me what you glean from that report and what you think the public ought to know.
Well, I think there's obviously the eye-catching moment when we realized that the total impact of UCA on the state of Arkansas exceeded $1 billion. That gets into pretty heady territory at that point. We wanted that study to be able to show that it's not just the reach that UCA has in a 9 or a 10 county area, but it's to every county of Arkansas. It's beyond the borders of Arkansas. It really is driving, if I remember correctly from the report, it's 0.8% of the state GDP. I mean, that really is remarkable that we have that impact. But the multiplier on UCA's impact is what our graduates do for the state. I love that almost $800 million of that $1 billion is a result of our alums and their work in the communities, what they do to contribute to towns and counties and areas all around the state. It really, we're proud of what UCA does for the state, and we wake up every day looking for how we can earn that reputation.
What do you do with a study like that? Who needs to hear that message? Does that help state legislators say this is a good investment? Does this help parents sending their kids there say this is a good investment? How do you use that study to make a case for something?
I think that we want people to glean that there's an individual investment that's made in higher education, and from that report we learned that for every dollar that a family and a student spend on their education, they get $5.2 in return over their lifetime. It's over $1 million of earnings that they'll have over the course of their life. And then for the state's perspective, the idea that that dollar that the state contributes to higher education, and particularly at UCA, for every dollar that's spent, they get $2.2 in return. So you think about that as an investment, not as a consumptive expenditure of the state. That dollar doesn't go away when the state uses it. There's a multiplier effect that it comes right back into making a difference for society and making a difference for state generally.
Higher education's playing under a new funding formula now in the state of Arkansas. I think it's smoothing out at least. What is your take on where that funding formula stands, and how do you think anything needs to be changed in it?
I'm a big supporter of our outcomes-based formula. That was actually when I was applying for the job back in the fall of 2016. A part of my interest in coming to Arkansas was that we were moving toward an outcomes-based formula. We had one in Georgia. I'd come from Oklahoma where we constructed that, and then Tennessee. I'd been involved in the 80s and 90s in the performance funding program there.
The old version was more on based on enrollment.
We're based on enrollment. It was really take a family picture on one day of the year, and we'll fund you for whoever's enrolled on that day.
Yeah.
The outcomes-based formula is more about what do you do with that family. Are you having productive enrollments? Are you getting students that you're making a compact with, that you're gonna make a compact with them, that if they are coming to your institution, you see them as worthy of being at that institution, and you're gonna meet them halfway with the supports, provided they put in the necessary effort to get across that finish line. So do you move people from freshman to sophomore to junior, junior to senior, and then across that stage? That to me is a better proposition for the state to look and see that we want to see results. If you're going to enroll a student, then you're willing to meet them halfway with the type of supports to make certain that they earn that credential, provided that they're willing to put in the time and the effort toward that degree.
Let's talk about what it's like to be a student at UCA this fall. I have a feeling that there's a couple of different scenarios that you could be a student at UCA this fall.
It was important that we put options forward to students. Overarching terms that come to mind are strange and weird compared to the norm, because there's nothing about those options that are normal. We knew that we had a number of students that they only wanted to be enrolled in an online capacity with us. And as we're looking at our preliminary enrollment, about 7% of our student body is exclusively online from the beginning. But that means that 93% are something else. And that's students that are involved in a mix of courses. It might be if they have 4 classes, 2 of those are online, 2 of those are in a hybrid sort of mode. It might be that they may still have face-to-face courses, but they're meeting in small groups with their faculty member. Mm-hmm. Everything about all 2,500 courses that we offer this fall had to be adapted for this COVID-19 environment. So it's different, but we put forward options to where our student body could feel like they could come with confidence to us. And again, we wanted, if we were going to start on August 20th with them, we wanted to make certain that we had a plan to be able to go all the way through the end of term.
There's a responsibility for students as well as the administration to abide by certain standards in order to keep COVID-19 under control, in order to not allow this to get out of hand on your campus. Assess for me how you think that is going a few weeks into the school year.
Right, we're roughly 3 weeks into residential operation at this point, and the top 2 things that we expect of students are to wear their face coverings and keep distance. We have 3 million square feet of facilities on the UCA campus, and every square foot of those facilities have been reset with social distancing in mind. That's from classrooms all the way through a mechanical room. If 2 human beings are going to occupy a space, we've had to rethink how human beings interact in that space. But the number one thing is that we want students to wear face coverings anytime they're in enclosed environments. Right now, we feel very good about how that's playing out inside of all of those courses and inside of the classroom. Our faculty have reported to me that they have been pleasantly surprised that students have come to the table ready to respond with what they've been asked to do. I am not, because I think our students and their families They learned over a 4-month period of time that while they love each other, they might not necessarily like each other as much as they thought. And our students very much, especially those that are in the residence halls, those students that are attending courses in person, they want to see this semester through. So I've been pleased at their response. They've risen to the challenge. We, from the beginning, made certain that we set aside a healthy amount of quarantine spaces and isolation spaces. We have 134 rooms in Carmichael Hall that we kept offline this year exclusively to be able to house any students that did not have a place to be able to quarantine. As we speak today, there are 10 students in those 134 spaces. We have 85 isolation beds in houses around campus that from April forward we repurposed for that. As we sit here today, we have 9 students in those isolation spaces. So we felt like we had a plan for being able to raise the expectations of what we needed students and faculty and staff to do. And then we also had a plan for if we did have students that were positive or they were traced to a positive, for us to be able to have a place for them to have their needs attended to.
Walk me through that, I guess, just as a parent and someone who hasn't had to do the college experience yet in COVID-19. If someone's infected, I mean, my immediate response is that they're in a dangerous position, and isolating them in the room to me doesn't necessarily, it doesn't answer my concern right away, because they're still on that campus with the potential for spread, with the potential for risk. How is isolating them working?
Well, I can't speak to how the other colleges and universities are handling it, but we sort of worked through that calculus that these are spaces that are in houses on the periphery of campus. They're not in the interior. Those students, we felt it was necessary to not leave them in our regular residential halls. We're not utilizing any of the regular residential halls for any positive COVID cases. We wanted to be able to put them into houses where they could feel like they were removed, and our general population would know that they were removed from at least having any potential for exposure.
And I'm assuming that these are people that maybe have tested positive, but they're asymptomatic, because if they had some sort of symptom, they might need some stronger health care, correct?
Absolutely. And then we've got Conway Regional Health System, which is right there on the north side of campus. We're very lucky to have them not only as a strong local partner, but as a neighbor to our campus. Up until this point, we've had 41 positive cases on the campus, and I was talking with Dr. Randy Pastor, who he and his team in their health center have done an amazing job partnering with Conway Regional. Only one of those individuals has been symptomatic. I mean, which is really, it's a testament to making certain that we're taking the necessary precautions for people to wear their masks, keep their distance, do their screening that's expected of them every day, having the ability to be able to go and be tested. Timely testing is the key to this. As I talk with my counterparts around the country, I mean, presidents and chancellors all around the country have just lived in fear of, do you get to the point where you can't get test results back in a timely manner? Because it doesn't matter if you're testing, if it's 8 or 9 days, getting those results back, well, that asymptomatic person could have had all sorts of contact. We're very lucky that right now the testing operations that we do through Conway Regional Health System are getting test results back in 1.26 days. We feel very good about that. That's a part of our metrics that we report to the campus on a weekly basis. And as long as we can maintain that, and we've got the ability to be able to do the quarantine and the isolation when it's called upon, we feel very good about where we are. Those multiple metrics are things that we do watch on a daily basis, though.
A lot of colleges and universities that I have talked to have told me you obviously did a lot of planning. You had months to do a lot of planning for students coming back to campus, faculty coming back to campus. So there's something that's going to trigger a higher alert for you. What are those triggers? What's that mechanism or that point that you get to that you're like, we have too many cases, we have too much spread, we have to do something different?
Right. We were very fortunate that you go back to May. I mean, May 15th was the first time that I had it was a virtual conversation. We did it over Zoom with Dr. Ellis Arnold, the president of Hendrix College, Mr. Matt Troop, the CEO of Conway Regional Health System, myself, talking about forming a testing and tracing consortia to where and then we brought Central Baptist College into those conversations as well later, to where we would on a weekly basis, every Tuesday morning, have conversations about where Conway, where Faulkner County, where our respective campuses were on a variety of measures. And the things that we look at are Where is Faulkner County and where is Conway Regional Medical Center on their positivity rate? Last week, for the 14-day average for Conway Regional Medical Center was 4.6%. That obviously is well below the state's goal of keeping within 10%, but that's something that we're watching constantly because we don't operate alone. We're very much a part of a system and a part of a community. We have to watch things like testing turnaround. As I mentioned earlier, the idea that all of the tests that UCA and Hendricks and CBC are having done right now, the testing average days back is 1.26 days. That's something that we report out in that consortium meeting every single week. Then we also are reporting on things like where are we at utilization of our quarantine space? Where are we at utilization of our isolation beds? Where are we at the positivity rate for those that we're screening, such as our required screening that NCAA requires of athletes, versus our positivity rate for students, faculty, and staff that are believed to be or believed to have been exposed to COVID-19. So all of those measures are things that are in our weekly report, and it's really an amalgamation of those things that we then join with Conway Regional Health System, Hendricks College, and CBC to be able to have a conversation about where we collectively exist on that spectrum.
So when you see things at those heightened levels of
Absolutely.
positivity rate or turnaround time or capacity, that's what's going to trigger next level for you. Is
That's
what
right.
it sounds like you're saying.
It's a moving, very much a dynamic, fluid thing. I think that we've done a good job from March 13th to now because we've been working hard to keep that ball where we need it to be. We will have to work hard for the next 6 to 12 months to keep it there. But yes, it's comforting to know that our positivity rate for general screening, for instance, all the athletic testing, is below 2% right now. It's comforting to know that our positivity rate for this last week, even for those that are believed to be sick or believed to have been exposed, is just 13%. I mean, and collectively, we're still below 4% overall on positivity rate. But we can't just assume that those numbers are going to stay there. That is a daily, if not hourly, effort to be able to stay in front of it.
So last question for you, kind of what do you hope or think needs to happen in order to provide more stability, to get past this environment that you're in right now? Is it wait for a vaccine that's going to be the only solution, or is there something else that you see out there on the horizon that could make a difference, that could improve the current environment that you're in?
Well, I think that the easy answer, if you were to poll all 4,000 colleges and universities in America and all, what do we have, 45 or so, public and private in Arkansas, everybody would say, well, the vaccine would be the answer. I take a lot of pride, and Grandma talked about good kind of pride and bad kind of pride. It's the good kind of pride. I take a lot of pride in the fact that in April and May, we saw very early on that testing was everything. Testing turnaround was everything. Being able to have multiple labs that you can depend upon. Being able to have the necessary space to, once you quickly ascertain whether or not someone is positive, do you have a place for them to go where you can make certain that their needs are taken care of? I think that more and more universities began that work in June and July, and they're starting to finally hit their stride now. And I think that confidence and that capacity is going to click in. If there's anything that I think is a differentiator for UCA, is the fact that we recognize that, and we joined with our sister colleges there in the community, and we really were very fortunate that Conway Regional understood how important it was to be in front of that. And the work that we were doing in the spring is providing us the opportunities to be able to be proactive as well as reactive when we need to be now. And I may drive people on our campus crazy, but I've got a group that right now, all they're doing is focusing on thinking about next summer and next fall. I told them to keep notes of we will experience in August 10th next year. What was August 10th in 2020 like? Because we need to be ready for August 10th of 2021. Yeah. We don't need to assume anything in terms of a vaccine, because most doctors and most scientists say that we're still months and months and months away from having any reliable vaccine solution in this country.
So I teased you and said that was the last question. Now I have a follow-up to what you've just said. When you see what's happening on some other college campuses out of states, particularly where they've had some bad outbreaks, what do you attribute that to? Do you attribute that to a lack of preparation, a lack of testing, or irresponsible behavior, or something else?
Well, I don't know that I necessarily want to second guess my peers on all those campuses, but I do know this from the facts of a lot of those reports. If you dig into some of the reports that we've heard out of the Carolinas, when you really get into it, you learn that their testing capacity and the timeliness of that testing, they were sitting at a week plus. When you're at 7+ days on getting test results back, you just can't get a hold of it. You can't stay in front of it. So I think that that's kind of quietly behind the scenes been a big part of the problem. And then there's the, I think sometimes it's thinking about how your strategy fit your reality. If you have a student body that is from all over the country and all over the world, you can't rely upon those individuals if they have to quarantine out of safety, being able to do that 30 minutes to 3 hours from home. UCA is still an institution that serves Arkansans. I mean, 95% of our student body is from 75 counties in Arkansas. We knew that as we went into this, that we needed to have those 134 rooms in Carmichael. We needed to have those 85 standalone isolation beds if we had to house 85 positive patients. But we also knew that mama was going to kick in. We knew that there would be situations where if a student did have to quarantine, that mom or grandma or aunt, somebody was going to kick in, and there would be opportunities for them to go home. I think that when I've heard about those stories in out-of-state institutions, I don't think that they planned for enough quarantine beds. They didn't plan for enough isolation beds. Their testing got way out of their range of being able to manage it and keep things in front. And that's not their fault. I mean, that's just capacity of labs and capacity of health systems. And then I think that they also just had geography working against them.
That's Dr. Houston Davis, president of the University of Central Arkansas. There's actually much more to our conversation, which you can catch online in full at talkbusiness.net.